Welcome to our Freedom from Suffering Now blog. I'm Dr. Steve Grinstead. Today I want to talk about one of the questions I get asked the most frequently when I'm presenting at workshop and conferences, and that is, why do people start abusing their pain medication? That's a very, very good and complex question, because the answer is, it depends. Because nobody abuses their medication for the same reasons, but there are some common factors. One factor is people start abusing their medication because early on they weren't given effective multidisciplinary integrated pain management and instead put on symptom management with pain meds. Eventually, the person starts developing tolerance or adaptation or developing opioid-induced hyperalgesic effect. Or if they have a genetic or actual risk of addiction, they end up abusing their medications, they become dependent upon it, then they move into either pseudo-addiction or addiction. That's one reason a lot of times that it happens. But basically, a lot of these reasons can be stopped if the person gets effective multidisciplinary integrated pain management interventions early on. Even after they start developing problems, it's still not too late. I believe that effective chronic pain management needs to be appropriate medication management, and for people in recovery, that means recovery-friendly interventions. They also need to be dealing with the psychological, emotional components of the pain, and most importantly, learning what they can to do without using medication for their pain management. When they combine these three components together, they usually get some pretty good outcomes. A lot of times people get tagged as drug seekers, med seekers, histrionic, somatic disorder, etc. But many times it's because their pain just has not been adequately either diagnosed or addressed appropriately. Other times it's because we as treatment providers fail to uncover or identify coexisting problems, like mental health problems, for example, or psychosocial, family, career problems. The other day I did a blog on the grief loss piece. There's a whole lot of factors that contribute to answering this question of why people abuse pain medication. To learn more, and you're watching this on YouTube, please go to our latest Freedom from Suffering Now blog at the link below. You can also check out my books on the publication page, Freedom from Suffering, A Journey of Hope, or Managing Pain and Coexisting Disorders. I really want people to know that there is an answer to that question, but it depends on the individual, and each person needs to be addressed individually. Please check back frequently as I update these blogs periodically. Thank you for your attention today, and I look forward to having you join me again.